66-year-old Jamie presents today as a new patient. She was diagnosed 4 years ago with Parkinson's disease and has begun having trouble brushing and flossing, leading to bad breath.
All right, Jamie, I'm just finishing up your assessments now. Has anything specific been bothering you lately?
I have a really bad breath I've been noticing. Like I told you earlier, I've been diagnosed with Parkinson's and it's been 4 years now. I started with a small tremor in my right hand, but now it's progressed that I tremor a lot. I have difficulty walking. I move really slowly. So I am having a difficult time brushing and also flossing.
Okay, I'm really sorry to hear that. I'm glad that you need to come see us though because you're having the trouble brushing and flossing. So for treatment of the Parkinson's, that you do take levodopa 3 times a day, right? And that's the only medication that you're on for that?
Yes, we may need to change that soon because the disease has progressed further and I don't think it's working as well, and it's not as controlled anymore. I've been noticing though I've had a change in taste as well as sometimes I have dry mouth from the medication, I think.
Okay. Well, levodopa can definitely cause dry mouth if you take it, or you're taking it consistently and everything like that. Okay, so it can cause dry mouth. It can also cause pain in your mouth and throat, as well as a taste in your a change in taste. We can definitely recommend a few different kinds of mouth rinses and lozenges so that maybe that we can get that dry mouth under control. To help with the bad breath you were mentioning earlier, I'd recommend probably starting to use an electric toothbrush and an electric water irrigation system from here on out. I noticed during my examination that you have a lot of plaque buildup everywhere in your teeth. Your gums were bleeding during assessment, and those are both signs of periodontal disease. That definitely shows me that you're having trouble brushing and flossing like you mentioned. And although I'm going to do a full cleaning today, that will help with your bad breath, but your home care needs to have some work done so that you can keep it under control on your own as well.
Okay, I'm definitely interested in keeping that bad breath away. With everything else, I don't need bad breath. I believe I can start using an electric toothbrush. For the time being, what should I do if my tremors get worse? Or I've heard that I can have difficulty swallowing at some point.
Yeah, that is true. So you're at a stage right now where you're not having difficulty swallowing, which is great. But since the tremors are bad enough where you already can't floss, you should work on using your steadier hand. You said that the tremors started in your right hand?
Yeah, so my left hand's a lot stronger.
Okay, then that's good. So what I would recommend is starting to work a lot more with your left hand on brushing and using the water irrigation. Excuse me. And it'll be tough at first, but it'll keep your mouth a little healthier. You could also ask your husband for help in the morning. It'll only take like 5 minutes for him to help you brush and floss, and you would benefit from it immensely. If you do develop difficulty swallowing, you can actually start, instead of dry mouth like you're mentioning now, you can start to hypersalivate, which just means you'll have saliva pooling in your mouth because you have the difficulty swallowing, so you're not able to eliminate it at a normal rate. So if that ends up happening when you're using your water irrigation system at that point, you should be leaning over the sink and letting it kind of just dribble out of your mouth so that you don't have any of the bad effects from swallowing or trying to swallow and not being able to. So that would probably be a good thing. Okay. But that's when you would develop the hypersalivation. That's what you would do.
Okay. Yes, my left hand is significantly stronger. So I will try to make that work with brushing. It's going to maybe take some time. My husband should be able to help me. What if I have trouble grasping the handle? Because I can't really hold things very well.
Okay, well if you have trouble holding the thinner handle of an electric toothbrush or the water irrigation, then what you can have someone do is cut a hole into a tennis ball and just place the water irrigator or your electric toothbrush into that, and then you'll have a larger grip so that you can hold it and with your left hand obviously, and maybe reduce the strain that it puts on your hand from there.
Okay, that sounds great. Hopefully my cleaning today will help my bad breath, and hopefully all those great tips you gave me will help me keep up with my oral hygiene.
Yeah, absolutely. I'm glad I could be of help. I'll also make sure that you're seen in the office now every 3 months instead of every 6 months because you do have the difficulty in removing the plaque. So if you come in every 3 months, we can make sure that you're doing a good job at home, and we can make sure that no other problems are starting to arise, and if they are starting to become an issue, we can catch them right away and help you with some more interventions if you need them in the future.
All right, thank you so much for all your help and this great treatment.
All right, no problem. Let's get started with your cleaning. Thank you.
In summation, patients with advanced Parkinson's disease need assistance with oral hygiene and could benefit from help from a loved one and electric toothbrushes and water irrigators. Patients should be placed on a 3-month recall in order to ensure their oral hygiene is up to par, as well as to identify and arrest any issues that could arise due to their disease.